The CDC is now reporting new monkeypox statistics showing Black and brown communities are being disproportionately affected by the outbreak. The agency shared in a briefing this week that according to the CDC, Hispanic Americans account for about 33% of known monkeypox cases in the U.S., while Black Americans make up 28%. Emergency physician and ABC News medical contributor Dr. Darien Sutton is here with more on this. Dr. Sutton, how did the CDC determine this, and what does this data tell you?
Well, good morning, Diane. So the CDC sampled approximately 3,000 cases, and they found that in these cases, as you just stated, the majority or high percentage of confirmed cases of monkeypox belong to Black patients, approximately 28%. But that was more dramatic in certain states. For example, in Georgia, the sampling found that approximately 82% of confirmed cases of monkeypox belong to Black patients. Now, the proportion of those who are infected is significantly higher than the share of the population, as only approximately 14% of the U.S. population is Black. And of course, this is what creates the concerning disparity.
This is reminiscent of COVID-19, which also disproportionately impacted Black and brown communities. These are very different viruses, though. So why are we seeing this again? And when you look at where the data is, specifically in certain areas versus others, is there something that stands out to you?
I think that there are many things that stand out to me when we're looking at the outcomes of monkeypox and COVID-19. And to be quite honest, many examples within healthcare, we often see these disparities. It's multifactorial and nuanced due to a lack of access to care. But specifically within monkeypox, there was an inability for public healthcare communication to be inclusive. And by that, I mean early on in this pandemic and during the majority of the pandemic, photos of what monkeypox looked like included the majority of those patients who were white or lighter colored skin. The lesions can look like skin-colored lesions surrounded by redness, but for patients who are my complexion of darker skin, the lesions can look different. They can be hyperpigmented or darker in color. And you can imagine, Diane, that if someone has new signs and symptoms and they look at photos and it doesn't look like them, they're less likely to think they're infected, more likely to expose themselves to others, and less likely to get access to treatment and testing.
So how do we get around this now? How do we improve this for this outbreak and going forward, and try to ensure that people have access not only to the right education, the right kind of images so they can identify this kind of thing, but also testing, vaccination centers, and anything else that's needed from a public health standpoint?
I think we need to not just sit on this information, but act on it. It's important that we're strategic about the ways that we provide this education, increasing funding to community and sexual health centers, and making sure that we provide this information in places where those who are most vulnerable are more likely to congregate. And right now, that includes young men, making sure that this information about what it looks like, availability of testing and vaccination, placing it in places like sports arenas, gymnasiums, bars, barbershops, and making sure that it's simply making it available. I think it's quite simple, but sometimes we miss the mark on that.
All right, Dr. Darien Sutton, always great to have you. Thank you.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.